Good morning. This is Jolynn Cornelsen with Portland, Vancouver Hangout Local, and I'm interviewing Dr. Zayd Ratansi here, and he is in Wellness Without Limits. Dr. Ratansi, you're a naturopathic physician. Would you be willing to tell us a little bit about how you got started and what your focus is now?
Yeah, absolutely. I got started, well, I went to university to get my naturopathic degree at Bastyr University in Seattle, Washington. And then I moved up to Vancouver, Canada, and with a group of about 4 people, we started the first private multi-place hyperbaric oxygen chamber in Canada. And quite a mouthful there, but it's a high pressure chamber where patients go in and breathe 100% oxygen under below atmospheric pressure. So it's very similar to a submarine. And actually in this particular chamber I could fit about 10 active patients and another 10 caregivers. So it's like a big submarine. And we'll pressurize them down to 10, 20, 30 feet below sea level, and then they'll breathe 100% oxygen. Well, what that did is that caused a big stir in Canada, and ended up, after opening the doors, having a 9-month waiting list for people that just wanted oxygen. Now, how I really went into this field a little bit blind. I had a good mentor, Dr. Maxfield in Florida, who had been in hyperbarics for 25 years prior to me being a rookie. And I'll tell you, I had kids with cerebral palsy, with trach tubes, G tubes, seizures, and after watching what oxygen did in the central nervous system, I was definitely a believer, but I had to maintain some objective parameters because what I didn't say is how I really got in it was I saw how effective it was in our hospitals for diabetic foot wounds, wounds that just would not heal. And what they did is they took oxygen by mask or hood apparatus under pressure, and many of the wounds healed. And 75 to 80% of the amputations could have been avoided with a hyperbaric oxygen chamber. So, thinking about, well, the brain takes up 25% of your oxygen consumption, you would think that, yeah, I would say a brain wound after a stroke, or a child with a cerebral palsy or neurological condition, head injury, concussion, should benefit. And there's plenty of research out there. So we took the science that was out there, the research. We took the common sense that said, hey, it should work, and then we tried it with efficacy. And I've had probably some of the most astounding results on just giving people extra oxygenation in their tissue, not drinking it, not eating it, breathing the natural way, extra oxygen, and their body just starts recovering. And I could keep going. Actually, it was about 7 years after practicing this way that I realized I wasn't doing anything. It was the oxygen was giving extracellular energy into the body. And that cellular energy was the body's currency for speeding up things, whether it was function, whether it was repair, healing, or tissue growth and regeneration. What a great combination. So the model that we looked at is when you cut yourself, you see the skin heal. And when it didn't heal was, some of these diabetic or these wounds that we just applied more oxygen, more blood flow, and wow, told us the body knows how to heal. We could be doctors all we want and say, hey, maybe it's this factor, things are going on in the body, but the body really does know how to heal. Give it the supportive mechanism, and especially this currency exchange, a high amount of oxygen that increases your body's currency called ATP. That's your body's energy. And let the body fix itself. Let the body do what it knows how to do.